Hi, my name is Livy. I'm the clinic manager and registered nurse here at Capraro Plastic Surgery and Regenerative Aesthetics. Today we're going to be showing our lovely patient here how to self-inject NAD at home. So this would come in the mail as well as some supplies, and she would do this every day. So we're going to show you exactly what to do when your package comes in the mail. So first thing, this one is open, but the one you get will not be open. It'll have a little piece of metal on the top. But the first thing that I'm going to have her do is look at the bottle and make sure it looks correct, and make sure the expiration date looks correct, and make sure there's medication in the vial. The other thing that she needs to check is written right on here how this should be stored. This is NAD+. This should be refrigerated all the time. So when you receive it as well as after it's opened. So now that we know all of that, it's time to inject. So our lovely patient's going to start by washing her hands. And while she's washing her hands, there are 3 places where you can inject a subcutaneous medication. So subcutaneous just means that it goes in a little bit of fatty tissue. So the best places for that are right behind the arm, in between the elbow and the shoulder, in just a little bit of fat everyone has behind their arm. The lower abdomen, 2 inches away from the belly button, and then also the thigh, sort of the mid-thigh here, again, just where you can squeeze and get a little bit of that 1 to 2 inches of fatty tissue that we all have. So now that her hands are washed, she's going to take an alcohol swab and pretty thoroughly clean off the top. This one, like I said, has been opened because we've used it before, but the one you have, you'll have to take the metal off the top first. So now once that's all good, we're going to talk about dose. So you will be having a dose of 30 units to start per day. So on your syringe, there's going to be a 30 unit mark, or it'll say 0.3 mLs. It's the same thing. The dose starts from the top of the plunger and all the way down. So this is a bit of a smaller syringe. The one you get at home might be a little bit bigger, but it's still important that you only go to the 30 unit mark when you're drawing up this medication at home. So Emily is going to take the orange part off and be very careful of the needle. It just pops off. It goes in at 90 degrees into the top of the vial, and then you're going to flip it upside down and draw medication. That's perfect. Perfect. So then just take the whole thing out. Okay, and then so she has that here. The next step is to clean off with an alcohol swab the area where she's going to do the injection. So she's going to take that. And then I would recommend sitting down for this because sometimes the NAD can make you feel a little bit funny when it's first going in, just because mitochondria get that rush of energy. So she's all cleaned off now. She's sitting down. She's going to do a little squeeze, and then it just goes in at 90 degrees right into the tissue. Yep, and then you just slowly plunge it in, nice and slow, because the NAD, if you push it in too fast, can make you feel a little bit wonky. So she's doing it nice and slow. And then once that's all in there, then she just pulls the needle out. And you're very careful about the needle not touching anything. She's gonna just gently massage the area for about 30 seconds. If she notices any bleeding, she'll put a little bit of pressure with the alcohol swab for about 2 minutes. And then she's going to make sure to dispose of this in a sharps container. And then she's going to just sit down for a few minutes and make sure she doesn't feel funny after the NAD, because sometimes the NAD can give you a little rush of energy or make you feel a little bit woozy.